I am Nahid Kabbani, and this is the Lighthouse for today's viewer. Welcome to our show. Today we are at SAHA Clinic in Carmichael on Marcoli Street to let you know what they are doing there on third Saturday every month for helping the refugee for health issues. Let's walk you through this clinic.
Hello, my name is Bejan Alvandi. I'm a volunteer at the SAHA Health Center. I've been volunteering here since February or March of last year, and this is a free primary health care clinic specifically for our target population is the Middle Eastern community of Sacramento, but we are open to people of all nationalities, races, and people that do not have health insurance. All right, and I'd like to show you around, walk you through what it's like to be a patient at the SAHA Health Center and show you the experience that you have when you visit our clinic. So if you please follow me.
Yeah.
Okay, so this is the reception area. When patients come in, they go over to the nurse and they check in, they sign in, and they wait here for the name to be called. They're going to move through a three-step process. First, they will be intaken by the nurses, where they'll collect their vitals, and then they'll be taken to a room where they'll see a doctor or one of our qualified physicians. And then, once they're done, they'll move to the discharge station where they will be discharged from clinic. So this is our intake station. This is where patients are called in by the nurses and they have their vitals collected, such as blood pressure, pulse, their blood sugar levels. They get their height and their weight collected. And if they have any concerns, they relay that to the nurse, who then prepares the chart for the physicians who are waiting in the physician's room to prepare and see the patient. All right, so please follow me this way. So this is the physician's room. This is where they work on notes and they consult with each other when they see patients, where they get second opinions and see what is the best course of action when it comes to each individual patient. And this is where all the heavy lifting gets done. So these are our wonderful physicians. They volunteer their time completely for free for the community. They're excellent with the patients. They're very knowledgeable. So this is one of our clinic rooms. We have 4 clinic rooms, and you can see that we're equipped with all the essentials. We have a bed, we have all the hand sanitizer, gloves, blood pressure cuffs, everything. The rooms are equipped. We have needle dispensers, so we are up to date and up to code with everything. We try to provide the best service that we possibly can. The best quality healthcare with compassion and empathy. This is where patients are called in. We try to get them out in and out as soon as possible as well. So this is the discharge station. When patients are done being seen by a physician, they are brought here. This is where they get all their paperwork together, whether it be prescriptions, whether it be lab order forms. We make sure that the patient is leaving with all the proper paperwork and all the proper resources, and we make sure that if they need to schedule an appointment for some other time, it's done here.
Okay.
Yeah. I'm sorry. We just got all that.
Your assistant is ready to go for TV.
That's right. He's
doing good. Can you interview Dr. Muhammad? Ask him the question. Ask the question what you know.
Okay,
it's important to.
I'll try my best.
Have a seat beside her. Okay.
I'll try my best.
Yeah. Next time you will do your show.
Okay.
Again, introduce yourself as a interviewers. Yeah.
All right. Hello, my name is Bejan Alvandi. I'm a volunteer at the SAHA Health Center, and this is
John Mohammed is my name. Hello.
He's one of the physicians that volunteers here regularly at our clinic, and was one of the founding members of our clinic as well. He spent a great deal of time trying to make sure that our clinic is a success, that it serves the patients, that it provides quality health care for everyone who walks through our doors. So, Dr. John Mohammed.
Hello, Bejan. How are you?
I'm doing great. How are you doing?
Thank you.
Good, good. Would you mind sharing with us your experience at the SAHA Health Center?
Right. First of all, this clinic was started about a year ago as a result of a need which we felt was there in serving the refugee population which has been coming to Sacramento area from Middle Eastern countries as a result of all the displacement that's happening. These people have practically no access to medical care, and as a means of giving them some access to basic medical services, we established this clinic exactly a year ago now.
How have you seen this clinic grow over this past year?
Right. As we found out that initially people did not know about us, they were a little bit suspicious as to what exactly we are, but as the word of mouth spread, we're getting more and more people come and ask for our services. Not only that, but we have a variety of providers, physicians and non-physicians who are volunteering their services here. It's all volunteer-based organization.
Great. And specifically, what services do we offer at the SAHA Health Clinic?
Right now, we are offering basically primary care services to take care of the basic medical needs. If they have diabetes, if they have heart problems, this is the kind of thing that we are at the present providing. Although we are gradually increasing our service area to include women's issues, but we are approaching it somewhat gradually.
Great, great. And what future plans do you see for the SAHA Health Clinic?
As we are seeing that there is more and more need, so our next step would be to increase our frequency of the clinic from once a month. At the present time, we have it every third Saturday, and to at least twice a month, because there is definite need for more regular and more frequent services. So,
are you open to any other, besides refugees and Middle Eastern population, are you open to individuals of other backgrounds and ethnicities?
Oh, absolutely. We started off as our base population, but we are open to all communities, and anybody who seeks help, we are available for them. We don't charge anything for the services. If they need any lab work, then whatever are our costs, then the patients pay that. But otherwise, there is no out-of-pocket expense for the services that we provide.
Is there any specific story you can tell us about your health?
Yes. Apart from the services that we provide here, which is medical in nature, we are also finding out that people have other needs. For example, people who are new here have no way to access the system. We had recently a patient who is a recent visitor here from Lebanon who happened to be over 6 months pregnant. So we had to scramble around to find out how we can get her in the system to where once she comes due for delivery in the next couple of months, that she will have the services. So we were able to fortunately get her into the system where now hopefully when she does deliver, that she'll be able to go to the hospital. So we are finding out that there are other needs. And if I may also put a little plug in, that there are other organizations here in town who are also trying to provide similar services to the refugees by way of providing access to the facilities, to the governmental agencies, and any other organizational services that are available for these new immigrants to this country.
I would like to add your service to our service. Maybe it put hands together to help more, to give more help for the refugees.
I think that will be a wonderful opportunity for us to work together, because we are both sharing the same need that we're trying to fill for these people. So we look forward to working with your organization in making this happen.
Oh, I know. What is the address of this?
We are located in Carmichael, and the physical address is 4836 Marconi Avenue. And the name of our clinic is SAHA Health Center.
Across the street, close by.
We are on Marconi, very close to Walnut, just west of Walnut.
Well, Dr. Mohammed, thank you for your time.
Thank you very much.
Thank you for giving us opportunity to shed some light about what you're doing for our viewers and our newcomers, new guests in this country, the refugees. And on behalf of them, I thank you very much. Thank you, Bejan, for this kind of kindness and doing the interview for Dr. Mohammed.
Well, thank you, Nahid, for stopping by. And I can see that we have a lot in common, that we can work together in order to help out as many people as we can.
And next time, maybe I want you to be in the studio to do Iranian show in your language for Iranian people.
I need a lot of work in my Farsi before I do that, but we'll see.
Okay, there is a potential job for you. Thank you very much.
Thank
I
you,
appreciate
Nahid.
it.
Appreciate it.
بتحكي عربي؟
I speak Farsi and
Farsi.
Hindi.
Okay. Tell your name and introduce your business.
I am Manas Padash. I am a social server and I'm supporting the SAHA Clinic since the day it started. My job here is to see people who need Medi-Cal, Medicare, who don't have access to any insurance, and I help them with all their needs. I also help them finding schools for the kids to go, interpreter if they need to go for any doctor's appointments, and I also take them to doctor's appointments and bring them back if they don't have a ride. I do all this in my own time. I was working with Intel and I'm retired from there now, and I have time to help people. And here I am trying to do anything I can to get the best for the group. I work for the Indian community, I work with the Iranian community, I work with the Pakistani community. Anybody who needs help, my number is given to them and they call me and I help them out. I'm a social server, full-fledged here to help. I know what is needed to get Medi-Cal, I know what is needed to get hospital people. Like pregnant women come here, they don't have Medi-Cal. I know that Medi-Cal helps people who have pregnant and they don't have to pay anything because they don't have the money. So I've been directing them to the right place, right source. This is my job and I'm having fun doing it.
That's wonderful. Your experience is very bad needed. And really appreciate your voice also as a woman helping them.
Thank you.
And God bless you. And I will take your number in case I need your help.
Sure. Thank you so
Thank
much.
you for
She'll be the one to coordinate. In fact, next time when we have our meeting together with that group, you should be there.
Yes, I definitely will need help. Yes.
So this is what I started. I was working with Intel for 25 years and then I got disabled because of my health. And the doctor said no more work, otherwise I won't treat you. So I took off from work and I got treated for. It took me 2 years to get well. After 2 years I dedicated my life to the people. And here I am now. Anywhere there's social service needed, I'm there to help. Any phone call, if you look at my calendar, it's all doctor's visits, doctor's hospital, interpreting. I've been doing that, a doctor introduced me to interpreting. So I've got a job as an interpreter now. I interpret Hindi, English, Farsi.
We need all kind of languages now because we have a lot of new guests with new languages.
I speak 5 different languages. Yes.
So
anytime you need me, I'll give you my number, give me a buzz, and I'm available for service.
I will. Thank you very much.
Thank you.
I appreciate that.
And then
Introduce yourself.
I am Dr. Ben Nazari, and in SAHA Clinic, I work as primarily an orthopedic consultant, but I could see general patients as well. But for the most part, they use me as a orthopedic consultant, and I see patients with orthopedic problems, and joint problems, and issues with spine and such.
There is a lot of those stories with the refugees. A lot of that kind of sickness with refugees need help.
Yes, whatever that I can do to help, I do that.
We appreciate your help, actually. Is there any, how many or how crowded is your clinic become?
Well, let me tell you something. It's very surprising, but some days that I come here, I see more patients than other physicians in this clinic. And there are several. So there are a lot of people who have orthopedic problems. And so they all get sent to me.
It's become like a code.
Yeah.
For elderly people, and for people come from that far.
Exactly. Young and old. I just saw a patient with fibromyalgia, which is a medical problem that has to do with the stress and has to do with lack of sleep, and so, you know, I see patients of all walks of medical issues, and I'm happy to be here to help people.
You mentioned the stress,
Yes.
which is popular.
Very
in this
popular,
matter.
very popular.
What do you do with the
unfortunately, these days.
stress?
So I tell you what I recommended to this patient that I just saw, a very young patient who goes to school during the day and at nighttime goes to work. So, you know, he has to juggle school and work, and so as a result his sleep is broken up. So he sleeps 2-3 hours at night and then 2-3 hours during the day. So now he has all this, you know, stress and lack of sleep. They have culminated in this fibromyalgia problem that he has. So, you know, I told him this is definitely a stress related. He needs to try and somehow sleep better and avoid stress. And also, I gave him a prescription for aerobic exercises to do daily, because this guy doesn't have time to do any kind of exercises. But we could always take half an hour in our day and exercise. I mean, half an hour is not a whole lot to ask, you know, us to exercise. It's not a whole lot. I'm not asking for 2 hours a day of exercise. Half an hour.
Reasonable time make difference with the health issues.
Exactly.
What about the joint and things if they need surgery?
Okay. Well, we don't have any way of taking care of patients' surgical issues. So we take care of their medical issues, and when it comes to surgery, we might need to refer them to a surgeon. Yeah.
And
This clinic,
is there any kind of giving from surgeons or that part of the service?
Right.
Is there any kindness, kind people to help free or something?
yeah, we are trying to find some consultants in town who could help us and take care of our patients who might need to have surgery.
That would be great.
Yes.
That would be great.
Yeah, that would be awesome.
You are doing a great job and very bad needed for the humanity and the communities.
Yeah.
Thank you very much.
You're very welcome. My pleasure.
Anybody else?
Hey, my name is Natalia McCormack. I'm a Sacramento State nursing student. I'm in my 4th semester currently, and I've been working with SAHA Health Clinic since March of last year. So I've been here for a year at this point, and I love it. I've been enjoying myself a lot. I love working with the population that we're working with and the underserved. So it's definitely something that I've gotten a lot out of.
What are you doing?
What do I do here? Well, there's a lot of different roles that I've played over the past year. I've helped with the electronic medical record, so signing patients in. I've done triage, where you do vital signs and you kind of screen the patients for health problems. I've assisted with some level of organization in the background. So lots of different roles played.
Thank you. Thank you.
I'm Zainab Hussein, and I started from I've been volunteering since it was open, and I make appointments for the new patients, and yeah, I just like make new patients for them and make set up new patients. Document them and make files for them, make them sign papers and get them to the doctors they need.
That's wonderful. That's wonderful. Thank you.
Hello, my name is Fatima Nefeya, and what I do at SAHA Health Center here is I help out patients, I help the nurses, and I take temperatures, I help at the front desk, I take blood sugar, things like that.
How old are you?
I am 10 years old.
Bravo. Good girl.
And how long have you been doing this?
About a few months now, probably.
How do you like it?
I think it's fun in a way. It's a good experience. I think that maybe I could use this experience in the future because my dream is to be a pediatrician. So
That's wonderful.
Switch.
My future.
That's
In
it.
the future,
Switch.
she talk about future.
Come.
You don't want to be on TV.
Okay.
Just try it. We won't put you on TV.
Think about being a leader. Okay? Don't let anybody lead you. You lead people because you have a great vision and great strong personality.
My name is Nasir Nuruddin and I'm a professor at Sac State. And I also serve on the board of Koba Foundation and I'm the director of SAHA Clinic. So as being a faculty at Sac State and having a contract with Sac State, we are considered as a clinical site for Sac State. So Sac State students usually they volunteer at our clinic, nursing students, and they come and help out, starting from admission to triage to discharge, and they've been instrumental in the success of this clinic. If it wasn't of our Sac State students, how we would have been able to operate the clinic? Because every month we have at least 8 Sac State students who come in and help out in running the
How many patients you see?
regularly we see close to 30 patients. We've started last year, exactly we have finished our first anniversary, and we have imagined 12 clinics so far, and with every clinic we only operate 4 hours, which is basically from 1 to 5 when the doctors are seeing patients, and so far we have close to 130 patients.
Is there any list for the
Sorry?
clinics? List of the places where in the clinics, other clinics?
What we do, we have resources, all the available resources for people who are in need of help, like if they need eye services, dental services, if they need women's health, or if they need other services. We have some resources where we can refer them to, so they can go and see these resources. SAHA Health Center belongs to a non-profit organization, the Koba Foundation, and we provide services to people who don't have insurance, who are uninsured or even underinsured. And it's open to all the public. So we welcome all patients from all backgrounds. Actually, the idea started by providing services for new immigrants and for refugees. And this is basically the purpose behind establishing this clinic. The clinic also provides lab tests, radiology services, and we have physicians from all backgrounds who work at the clinic and who volunteer their time to help serve the refugees and people who don't have insurance. We're located in Carmichael on Marconi Avenue. On Marconi Avenue, it's 4836 Marconi Avenue, Carmichael, California 95608. And our working hours are every third Saturday of the month from 12 p.m. till 5 p.m. Physicians usually start seeing patients at 1 p.m., but we start triaging and checking patients at 12 p.m. 12 p.m.
Are we planning to open more days or not just?
We have a mind to start to move to more than once a month, but we're still working on the logistics and staffing because this is a volunteer work and it's hard to find staff and physicians who are willing to give up all their weekends during the month. So it's in the scope. We're looking into it.
Awesome. That's wonderful. That was the day in SAHA Clinic. Thank you for watching. Visit that place if you need it. Tell other people if you know they are in need for this kind of help and service. And thank you for watching. We'll see you next time. This show was sponsored by Aquamarine Jewelers.
Hi, my name is Ayman Nasrawi, the owner of Aquamarine Jewelers. We've been established since 1996. We are located on 3416 Arden Way. We specialize in custom design, and we have jewelry for all the needs that you might need.
أهلا وسهلا فيكم في برنامج أهلا وسهلا. اليوم احنا في زيارة خاصة لصحة كلينيك على شارع ماركوني في كارمايكل، لأنه نقول لكم إيش بيعملوا في هذا الكلينيك لحتى تقدروا تستفيدوا من خدماته، لأنه بعتقد إنه في كثير محتاجين لهذه الخدمات، إذا عرفوا عنها ممكن يستفيدوا منها. خلينا نروح نزور المحل مع بعض ونتعرف على إيش إمكانياتهم في المنشأة.
مرحبا، اسمي نسرين نور الدين. أنا بروفيسورة بساكستين، بدرس بالجامعة تمريض، وأنا بنفس الوقت بخدم على البورد أوف قبة فاونديشن، ولدينا بفكرة العيادة خدمة للناس اللي بمجتمعنا يلي ما عندهم انشورنس. وكوني بدرس بالجامعة قادرين انه عملنا كونتراكت مع الجامعة مع ساك ستيت، ونحن عم نجيب طلاب ساك ستيت تمريض يجوا يشتغلوا هون بالجامعة بالعيادة ويساعدوا كل الاشراف على رعاية المرضى، بدءا من التسجيل بالفرونتس للترياج، بيعملوا فحوصات وضغط ونبض وحرارة، وبعدين بيرجعوا للديسشارج، يعني بيتابعوا المريض من البداية للنهاية. وأنا أكيد هون كوني مدرس بقدر أشرف على الطلاب وأكون موجودة حواليهم. فكمان هيدي نوع من الخدمة اللي نحن بنقدمها. بنرحب فيكم بالصحة، مركز الصحة الطبي. نحن هون عم نقدم خدمات مجانية للاجئين ولكل المهاجرين العرب وغير العرب. هدفنا انه نساعد الناس اللي ما عندها تأمين صحي، فالإنسان اللي ما عنده تأمين صحي وما قادر انه يتحمل تكاليف المصاريف الطبية والصحية بحاجة لعلاج، نحن بنوفر لهم علاج مجاني بالعيادة. اللي بيصير انه المرضى عندنا بيجوا ممكن الطبيب يكشف عليهم مجانا، وبنقدر نعمل لهم فحوصات طبية او أشعة بأسعار رمزية. والعيادة بتفتح مرة كل شهر، ثالث سبت من كل شهر، وأوقات الدوام عادة من 12 ل 5. على 12 بنبلش نشوف المرضى ونعمل لهم تشيك ونسجل المرضى، وعلى الساعة 1 الأطباء ببلشوا يشوفوا المرضى. فنتمنى نقدر نقدم أي خدمة للاجئين والمهاجرين اللي بعدهم جداد بالبلد وما بيعرفوا كيف يحصلوا على الطبابة أو ما عندهم الإمكانية المادية إنه يحصلوا على الطبابة. هيدي إحدى الخدمات اللي نحن بنقدمها. نحن تابعين لمؤسسة قبة فاونديشن، اللي هي مؤسسة خيرية مجانية بتساعد الناس، وعندنا خدمات تانية غير الصحة، بس هلا مبدئيا عم نشتغل على الصحة كبداية.
شكرا لك. ان شاء الله تكونوا اخذتوا فكره عن المكان، وان شاء الله اذا بتعرفوا حد بحاجه لمساعده من هذا النوع تدلوه عليه وتخبروه انه في عندنا امكانيات مساعده. والله يجازيكم الخير، واهلا وسهلا فيكم ونلاقيكم في برنامجنا القادم. مع السلامه.